Doctors of Reddit. Who was the dumbest patient you ever had? Story 1. Rural ER doctor here. 35-year-old female walks in with the right side of her jaw and neck swelling. She says to me, "I think it happened because I ate some meat yesterday that my body is reacting to." 45 minutes later, she adds, "Oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that." Story 2. I'm a pharmacist. One evening shift, I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Patient, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Me, okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Patient, last night at 7 p.m. on the couch. TMI, I just need to know approximate time to know if Plan B will work. Me, we have this medication called Plan B, and since the incident happened within 72 hours. Patient, oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Patient, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me, she's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Patient, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? He was dead serious and I couldn't believe he was asking this. So I told him, no, at this time there is nothing you can take to prevent her pregnancy. Story 3. I'm a paramedic. An elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Story 4. Pharmacist here. I had a woman bring in a literal sandwich bag which she kept all her meds mixed up in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an Epoquel stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself, and to know the directions of how to take it. I've seen her a few times since then and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Story 5. Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. I had a patient who was a farmer, who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually was shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So to summarize here, you did absolutely nothing that I told you to, and this is somehow my fault. Never saw him again. Story 6. Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Story 7. Working midnight in the ER. Family brings in a 4-year-old at 2 a.m.-ish. I ask them what is wrong. Them ask him the 4-year-old. He said he needed to see a doctor. Me, did he say anything was wrong? Them, no. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m., purely because the 4-year-old said he needed to see a doctor and they don't know why. Me to child, why do you need to see a doctor? Kid, the doctor has suckers. Me speechless. To be clear, it is the parents who lack sense and not the kid. Story 8. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened. And when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in, the sperm travels. Story 9. This was one of the funniest yet cutest ones. I was a student doing a shift in reproductive health. The doctor was dealing with a patient who was struggling to have children. So you're trying to have kids but not managing to. So do you have any other kid? Patient, yes doc, I have one. Doc, okay, that is a good sign. Given this information, we need to do this and this and that. Patient, okay, great. A few weeks later, he comes back and says it still isn't working. The doctor discusses with him some more. And then the patient says, my wife told me that it would be relevant for you to know that the son I have is adopted. But that's make no difference to me. I always considered my own son. He was the best dad in the world. Story 10. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chips a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. Story 11. I used to work in medical oxygen tech. One guy needed such a high concentration of oxygen that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained many times to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on, literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside our EMS fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Story 12. I work in radiology, and I once had a patient who was told very clearly that she couldn't miss her sessions of radiotherapy, and if she had something urgent come up, she should inform us immediately so that we could quickly reschedule her. One day she couldn't make it, so she sent her twin sister to receive the radiation therapy in her place. Her twin answered yes to all the ID questions, had the same birthday, etc. It was noticed when radiographers had trouble matching her to the CT, because the CT was of a person who had undergone a mastectomy, whilst the patient still had both breasts. This, many years later, is told to new staff during training about the importance of ensuring correct identification because you would be stunned the number of people who try to skip the queue. The number isn't high, but it isn't zero. Story 13. Work at a vet clinic. We get a lot of this sort of thing, oftentimes with diabetic patients. One of the worst I've seen was an older owner come in with their extremely overweight diabetic dog. Owner says the dog has been slow, tires easily, and has been flopping around, which is odd for her. Doctor checks her blood glucose and it is so high, it is literally off the charts. Normal blood glucose for a dog is around 100 or so. This dog was beyond 1,000. We asked the owners how it got so high. Was she eating? Clearly she was because she was obese. Were you giving her the insulin? The owners proceed to say that they think she's probably fine without it. She's a strong and hardy dog. Ma-am, your 9-year-old 80-pound Dalmatian, is currently half alive on the floor because you don't give her the insulin. How they kept that poor dog alive that long was astounding. Story 14. Optometrist here. Patient booked in for an emergency appointment with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy, wobbly reflexes, haziness, the works. Me, what happened? Patient, it's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding light blue, so I used the same dye for both to match the color. Me, does that hair dye contain ammonia by any chance? Patient, I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me, unless you can convince then to change the color scheme to red, no. Story 15. This didn't happen to me, but it happened to my brother. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they detoured on their way to the surgical center and got her a full Southern breakfast. She damn near died aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized, and they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. Story 16. When I was in the hospital as a patient, there was this one guy in ER who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s. It is a mystery to me how this guy survived that long. Story 17. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials experimental treatment are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using cocaine while taking this drug will make your heart explode in layman's terms. This patient promises they're off the sauce and that they totally won't do cocaine while they're on the trial. 2 weeks later, they relapse and well, you can figure out the rest of the story. Story 18. I'm a vet. A few years ago, I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. Me, what do you feed the cat? The owner responded with a general food brand. Me, how is his appetite? Does he finish what you feed him? Owner, yes, he always eats everything. Me, how much do you feed him? Owner, a half cup. Me, once or twice daily? Owner, once every 3 or 4 days. Me, you only feed your cat twice a week? Owner, I believe in a more natural feeding approach, and based on my research, that's how often cats eat in the wild. This owner was slowly starving his cat to death based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats are not tigers, and that small wild cats eat 10 to 20 small meals daily. Surprise, surprise, the cat's lethargy and weight improved with regular feeding. If you enjoyed listening to any of these stories, please be sure to like and subscribe for more.